Hi, I'm here with Vanessa Felsman, who's a speech and feeding therapist and the owner of Family First Speech. And she is going to help you dig a little bit deeper into some of these speech issues that we're talking about and help you figure out what to do if you're finding that your child might need some help in this area. So, Vanessa, thank you so much for being here. Can you start off by telling us how speech and language issues can affect a child?
Sure. We look at a number of areas within speech and language that generally include four things. The first is receptive language. What words, phrases, sentences, and even gestures does a child understand? This piece is sometimes overlooked, but it is critical as children must understand what they hear in order to use language appropriately. Expressive language is what a child is able to express through words, gestures, sign language, and augmentative communication. If a child's not using words, it is very important that we support through alternative devices. Speech and articulation is part also, and it includes speech sounds, sound errors, and the ability to produce specific sounds. This impacts how children communicate with others and how intelligible they are. How much do we understand them? Parents often contact speech language pathologists when they realize their children are talking, but it's very hard for others to understand. Another category is pragmatics, and this is the ability to use words and use gestures and language to communicate with others, make friends, navigate the playground, and at school. The last one is feeding and oral motor. Often, SLPs work with families to support feeding for safety and nutritional needs. If your child has a limited diet, an SLP can appropriately assess the food that she eats, the way they eat them, the way they respond to different textures, and how they use their lips, their tongue, and their cheeks for feeding.
Okay, so that was very helpful. Now, how do these speech issues specifically affect a child's behavior?
Speech issues often become behaviors, impacting everyday life. Like take, for example, a child who has difficulty with sound errors or delayed vocabulary. He or she may shut down, not use words in public, or avoid interacting with peers or non-familiar listeners outside their families. Another child might be affected due to lack of speech. If a child cannot communicate using words, he or she might communicate by pushing or hitting his or her own head. This might be out of frustration, but it could also mean like we've got a headache and we can't communicate that. A child who does not know how to begin interaction with peers might get in trouble for behaviors at school. He might hit his friends to get their attention rather than appropriately using words to say, "Hi, I'm so-and-so," or "Do you want to play?"
Okay, so what can happen if your child is having some of these issues, but they don't get the help they need?
Well, early intervention is definitely critical. Challenges in any of the areas can and will become greater, and they could affect other areas, including behaviors, when they're not treated. So take, for example, a child who's having challenges with comprehension. If your child struggles in this area, he may do fine as a toddler or in the preschool years. But once you get into elementary school, this gap is going to be getting larger and larger because the demands become greater. Reading comprehension might be affected, following directions in the classroom could be difficult, and this same child might later have difficulty developing friendships and interacting appropriately.
Okay, so let's say a parent is watching this and saying, yes, okay, we have some concerns. What kind of questions should they be asking, and how do they look for a good speech or feeding therapist?
Okay, the first thing you want to think about is what area are you targeting? When you call a clinic, be ready to share the specific concerns or any diagnosis there might already be or any medical history that might share more information with the scheduler. You might ask for assistance to find the right fit. The front desk scheduler might be able to help you with that. And then keep in mind, if you have very specific questions, you might even ask to have a speech pathologist call you back. Often, speech clinics are offering complimentary consultations so that you can tour their facility, get a feel for what it looks like, and discuss your concerns. If you're dealing with specific questions such as fluency or apraxia, find out if a clinician has had experience in those areas and for how long. It might even be helpful to look up specific support groups related to your areas of concern because they can kind of direct you with questions to ask. What tools should the clinician you're looking for have in their tool belt? If you're looking for a feeding therapist, you might find a clinician who has had specific experience in related models, such as SOS for feeding or talk tools or sensory processing experience. In addition to experience, find a clinician's style. Are they more structured or do they use a play-based approach? Are you allowed and even encouraged to join the sessions? Do you get homework? Are you invited for training? Remember that relationship is very important here.
Okay, Vanessa, this has been so helpful. I want to finish here with one more question for any of our parents who have concerns about or a diagnosis of autism. So you are a unique speech pathologist because your clinic strongly supports sensory integration and you work with a lot of kids on the spectrum. So many families who have children with autism run into speech and language issues. And many of these families have huge breakthroughs with speech services when they target any of the 4 issues mentioned earlier or when they provide alternative speaking devices for their kids. Can you help us understand or offer any advice to us as a starting place for families just going through this now?
Well, definitely know that now is the right time to seek a professional. If you have any concerns in any of the areas that we mentioned, even if your child doesn't have a diagnosis yet, contact someone who can guide you. Often, parents are encouraged to wait until 2 to 3 years of age or until a child has missed a big developmental milestone. But remember that communication development happens within the first couple months, from eye gaze to cooing. There are strategies to support at all levels and ages, working on the foundations or the precursors of language. All of that is important to building the ability for children to use words, gestures, or signs to communicate with others. We've even had referrals as young as 9 months of age, and believe me, there's something to work on even then. You want to find a clinician who works on regulation, engagement, and two-way communication, as they are the foundation for learning and communication. You don't want to skip this step. We will talk a little bit more about the DIR floor time model, the developmental individual differences relationship model developed by Dr. Stanley Greenspan and Dr. Serena Weider in a later video, and we hope you stay tuned for that. You want to work with a professional to learn more about your child. Be a detective and find out why your child might be crying at the same time before lunch or refusing to eat a certain food. Sometimes parents keep a journal to document what they see in order to understand and support appropriately. If your child is overwhelmed and cries in loud places, maybe we learn that it's their auditory system. Before treatment, you might even be able to find some helpful solutions, such as choosing a restaurant with less noise, getting there at less busy times, or finding a table further away from the band that's there that night or a large group. Speech can work with other members on a team, such as professionals, including occupational therapists, to understand your child's body, their ability to integrate their systems, such as auditory, tactile, vestibular, and visual. Believe it or not, all of these systems really do impact communication. Be a part of your child's team. Find out what you can do and what you can work on at home. Share it with the school and teach anyone who's willing to listen, such as grandparents. You want to bring the work home in all environments for increased success. But please keep in mind that work can also be fun. Children learn when they are motivated and when they are very engaged.
Yes. Okay, well, thank you so much for being here. We hope this has helped you a lot. Hey, if you have any more questions, hop on our Behavioral Support Network Facebook group page. You can ask any questions there, and we will make sure you get some answers. Thank you so much for joining us.